Hello, guten Morgen, good morning everybody. My name is Sharon. If you're seeing me for the first time, I vlog my medical school journey. So welcome on the journey, or welcome back. Yo, today is my first day, my first week of my final year of medical school, and buzzing. I am so excited. Honestly, all I'm feeling is just excitement, adrenaline. I'm a very big nerd, and this is like the nerd Olympics. So yeah, today we only have what is it called? We have an orientation meeting in Silverest, which is very annoying because anybody wanna be no damn Silverest. But I'm gonna go and be a good girl and attend. So guys, check you out on the flip side. Okay guys, I am ready for this orientation meeting, and yeah. So I'm back, and it was an orientation meeting that could have been an email. The whole thing could have been an email, to be honest. Yeah, tomorrow I'm actually starting. I am 99% adrenaline right now. Like I cannot. I don't know. Like, we haven't been given a study list yet. We don't even have topics or anything. But study the most important. Yes, I'm trying to study. I'm gonna study the most important topics that I feel like I might come across in surgery. Yo, guys, my house. There's so many people here. What's going on with the doors? All right, guys. See you later. Okay guys, so I was initially going to study from the hospital, but a lot has changed since I was last here, hey, because I went and they closed it, like the little study area that only I knew about. They closed it. I guess everyone found out about it. So now I have to go and study from home. Guys, I really didn't want to study. Is that the rain? It's raining, guys. It's literally raining. Okay, I'll see you at home. I'll study from home. Talk to you at home. So I am back, and I just want to apologize for the terrible audio in this video. I know the audio is gonna be absolutely horrible. It's actually gonna be like this for a few more videos, like 2 more videos are gonna have this terrible audio until I replace my device. So while I still have my device, it's gonna be like this, and maybe some visual issues, but apologies in advance. Okay, I'll try to do better tomorrow, but today it was just busy from beginning. It was the first day, and being class rep means you basically have to like arrange and organize everything. So I had to be making calls, calling this guy, calling that one, calling this one, making sure everyone is in their right places. And we have got new babies from my school. Let me do this, yeah. So we've got new babies, 5th years, and it's so crazy because it took me back to my time in 5th year. Like, wow, how fast time moves, right? I was in 5th year now. I was helping the 5th years learn how to clerk and everything, and it was so cute because they're so tiny, they're babies. Anyways, so yeah, guys, apart from that, we had a round with the registrar's round, and the registrar was really lively. She was really nice. She was like, it's your first day, you guys, so I'm not gonna percuss you. So that was nice of her because the data, it was not there. It was not there. Last time we touched surgery was like 2 years ago, literally 2 years ago. So yeah, so these are the topics. There's a lot of them. In total they are actually 41. And then these are the topics I have to present. So I have to present three topics, and then these ones I have to have them in my head. As you can see, there's a lot of topics. So guys, those are my topics. If it was up to me, I would be done in 10 days. I would be able to do 4 topics a day, but that's just impossible. So I'm going to be doing 2 topics from home, and I'm going to try to sneak some time in the hospital just to do 1 topic at a time, just so that at least by the second week I should have all these topics in my head, and then I'm just practicing. Because I hate when you see a condition and you haven't studied that condition, and it's just like but one thing I like about this list, it has everything. It's got all the topics. So yeah, I'm gonna study, and I'm gonna eat dinner, study, and then eat dinner, and then study, then eat a snack, and then study, then eat another snack. So this is dinner, courtesy of Rasi. Thank you, Rasi, for cooking for me. Thanks to Rasi, I've been eating like actual food and not just snacks. And so far, this is the progress that has been made. So far, I have done burns. I feel like I know burns now. Me and burns are one. I feel like I can manage. Right now, if a burn patient was to come, I can manage them for sure. To manage burns. And then esophageal conditions. Our patient is an esophageal patient, esophageal CA patient who's going for theater on Thursday. So I've just been studying for that. I've done, I'm just looking at the anatomy of the esophagus because I already know esophageal CA. I did that during oncology rotation. So I'm just looking at the blood supply, the lymphatic drainage, nerve supply, and just some important anatomy things. And then I'll go through like a few more conditions of the esophagus. And then I'll be able to tick. So far I've ticked the burns because I've been knowing the burns. And then when I'm done, I'll be able to tick off the esophagus. Where is it? Typo, where did it go? Yes, I'll be able to tick this off. It feels so good to do that. And I'll be done for the day. Yeah. Good morning, guys. Today is Wednesday and we have clinic. And so at least I've got 2 topics under my belt, but I'm hoping to find some time to do a 3rd topic. So that's the situation, y'all. Yo guys, I forgot to completely, how was it, Doc? How was our discussion?
It was great.
Learned a lot. Now when it comes to burns, we can even treat you, eh? You guys, I am in this Chinese store. And no joke, they literally sell everything here. They've got everything known to man. They've got alcohol in this store, and they've got soccer balls. They've got gym equipment. They've got food. They've got mattresses. I'm here to look for a mattress, by the way. That's why I'm here. Let me show you guys. And then in front, they've got furniture, y'all. They literally have everything here. Everything. I'm back in the hospital, you guys. I absolutely forgot to collect my patient. I forgot that I have to collect the patient for tomorrow's theater, and I was actually halfway to home. I got distracted when I was doing my discussion with these guys, and I started just going home with them. So I've come back. I had to run to collect my patient because I'm not gonna be caught lacking, okay? They're never gonna catch me lacking, okay? Ever. So let me do what I need to do. Yeah. Okay, I collect my patient. Yay, I did it. Now I'm going home to study. See you guys at home. Guys, it's me. I'm back. I am back from the hospital. I had a very good day today. It was a clinic, and I just love my unit, you guys. I finally found a good unit after being a part of so many terrible units. I finally found a unit that loves teaching. I love my firm, my unit, my firm, same thing. Yes, and today was clinic. We discussed wounds and wound healing, and I'm just enjoying myself, you guys. I love surgery so much. Everything in surgery is fun and fascinating to me, and yeah. So I have got a lot of things to study. It's currently 16, 17. That's when I'm coming back. I have a lot of things to study. I have to study thyroid. And then tomorrow I have a discussion on appendicitis. So today I'm going to study anatomy of the thyroid, finish up the anatomy for the esophagus, and study some esophageal diseases and some thyroid diseases. So it's a lot of work that I have to do, and I'm very exhausted right now. Like I said, it's 17, so I'm going to eat some food and take a nap, wake up at midnight, and then study at midnight, so that I have midnight until the end of the night. And yeah, because right now nothing's getting in my brain. I'm just tired. Yeah, other than that, I'm really enjoying surgery. You know, just the thought that surgery is gonna end, and then one day, and then I have to go to peds. It breaks my heart. It really breaks my heart. I don't like peds. I just don't like it. There's so much chaos and disorder there. And also the fact that there's not really that much to do. I don't like seeing sick children, so I'll just go through peds. But I love surgery. I could do this like the whole year. It's day 3, but I'm having the time of my life. I really am. This is my definition of fun. Yeah, so I will see you guys at midnight. I'll see what to make right now, and just rest. I have to allow myself to rest, otherwise I will crash. I'll crash it and burn, because at the rate that I'm going, I'll crash it and I'll burn. Oh yeah, I managed to clerk my patients, by the way. I managed to clerk both my patients. Tomorrow is surgery. We're having an esophageal CA patient and multinodular goiter patient. So I clerked them, and yeah, patient had an esophageal CA, so they just have to do an esophagectomy, and then for the goiter, they have to do a thyroidectomy. Yeah. See you guys tomorrow. Hello guys, it's me with a British accent, and today we're gonna talk about I don't know why I'm talking like that, sorry. This is the game plan for today. I have to do esophagus in anatomy. I have to finish it, esophageal CA. This is revision because I already know this, but I just have to revise it. First I have to find the book and then I have to revise. I have to do dysphagia because we're going to discuss it tomorrow in theater. I have to do appendicitis, thyroid anatomy, thyroid conditions, and these are extracurricular activities, Dutch learning. Yeah. Today's food, a la mode racial. And the loud volume is because I live with my brothers and the music is loud. Okay. Hi guys. So it is currently 21. I was supposed to sleep, but it didn't happen, child. And anyways, I have so many things to study, like you guys just saw. And yeah, I saw some of your messages on my comments. I had my YouTube off. Oh my god, you guys, my heart, my beautiful heart. Anyways, so guys, please excuse all the TV Turner music. But look, I found my notes. I found my esophageal notes. I'm so happy. This is great because it means I don't have to start from the beginning. I can study from. Say hi, Ras. Yeah. This is great. It means I can now start studying from. Yeah. I'm so happy. And my prostate cancer notes are also here.
So let's start with the pharynx, which also has a respiratory function because it conducts air to the larynx, from where it passes through the trachea and into the lungs. The pharynx extends from the cranial base to the inferior border of the cricoid cartilage anteriorly and the inferior border of the C6 vertebra posteriorly. It's located posterior to the nasal and oral cavities, and it extends inferiorly.
Hello guys, it's me in my robe again. I'm going to have this robe, I feel like, the whole video. I feel like for anatomy, when it comes to me, first of all, I'm a visual learner, and for anatomy I really have to see it. I have to watch the video. I have to look at it like, oh, that's what's happening, you know. Otherwise I'm just gonna be like, you know. So yeah, I'm gonna do that, and then after that I'm gonna do esophageal CA, then I'm gonna do dysphagia. And then when I'm done with that, I'm going to now touch on thyroid anatomy of the throat. And then when I'm done with that, I'm going to work on my presentation, just making it neat. And so once all things are considered, where am I gonna have time to study? I won't have time to study. So when am I gonna have time to sleep? I won't have time to sleep. But then Dr. Piri told us that we're not supposed to be sleeping anyway, so So you guys, it's currently 1 a.m. and I've managed, I know I'm writing on a book like someone from the 50s, but I like writing. I love writing. That's how I remember. I've managed to do anatomy of the esophagus. I went pretty far. And then for my YouTube video, this is how much I was able to cover. So here we've got the incisor, where we measure the esophagus, like the distance we start measuring from the incisors, because it never shifts. It's pretty much the same every time. Yeah, because the upper jaw is immovable. So we start from like the front teeth, and then this part here is the cricopharyngeus muscle. There's also the inferior the inferior pharyngeal constrictor muscle here. So this is our C6 level. This is the beginning of the esophagus. And then esophagus has got 3 parts for the cervical, thoracic, and abdomen. Anyways, guys, I want to bore you. This is some parts of the blood supply. The cervical portion is supplied by the inferior thyroid artery, blah blah blah. But power is gone, so I'm just gonna finish up real fast, then hopefully to be back by 4, so I can do thyroid anatomy, because I haven't studied thyroid anatomy. This is really bad. I can't go into thyroid thing without studying thyroid anatomy. As it is currently 5:50 a.m. and this is when power just came back. I'm so annoyed. I'm so annoyed. I'm so angry. I'm so pissed, Zesko, if I catch you. So now I'm gonna try and do some studying in 20 minutes, at least thyroid anatomy, and the rest I'll do it at the hospital. Good morning, guys. So I managed to do thyroid anatomy and esophageal anatomy, but there's a lot of stuff that I have to do, so I have to hurry up at the hospital. I'm running late. I want to go there early. They usually take a while to set up theater, so I'm hoping I can be there as soon as possible. Yeah. Okay. I made it. Now on my way to theater. Data. Okay, at least I have some data, so yeah. Yeah, there's data in my brain.
A very handsome man.
After getting forecast and not knowing the answers.
Handsome man here.
Can't see your face though with your mask. Done for the day. I'm done. We're done now. We're now going to the major ward round to check on the thyroidectomy patient. Yeah, but they found metastasis for her, so she's just going to go back to CDH stage 4. Hi guys, I don't know if I'm even visible in this heat, but we're done for the day. You guys, the worst thing to ever happen happened. I studied esophagus. We had 2 theaters cases. I studied the esophagus. I knew the esophagus really well, and then the thyroid I only studied like 30 minutes because power came like around 5:30 in the morning, right? And I had to leave. So tell me why we get to theater. We start with the thyroid first of all, which I'm already behind. I didn't get study. I didn't have power, and then our esophagus case gets cancelled. Now it looks like we're so unserious to the consultant, but it's fine. I'm going to learn thyroid anatomy. It's the first thing I'm gonna do when I get home. And then I'm gonna make sure my phone is charged, and then I'm going to wake up to study everything else. Ciao. Bye. I am back home and I feel absolutely horrible. I feel absolutely horrible. I'm tired. I'll see you guys tomorrow. I'll see you guys at midnight when I study. I'm gonna try and sleep. I just have so much to do. So first things first, charge my phone. Second things first, pass out. I don't even have, you guys, I have so much to do. Good morning, guys. It is currently 2 a.m. I just woke up and I'm heating up my food and I'm gonna start studying. Food. Okay guys, this is me in a storeroom as, I don't know, I want to say as usual, but we're having call day today and it's my first day. Well, not my first, it's my first call in this unit. I am not dressed for call. I hope they don't call me out on it. I'm getting my scrubs tailored, and the ladies took longer than I anticipated. So I studied the thyroid anatomy and I studied thyroid conditions. So today, any questions on the thyroid, I got them, you know. Anyways guys, I am off to do a lot of work. I'll try to be vlogging. I know so far I've not been really good at this whole vlogging thing. For this vlog, I've just been a busy girl. How's it going, Doc?
It's well. It's very well.
First call is 7th years. Are you excited? Let's go this way. Are you excited? First call is the 7th year.
Yeah, you know, I'm so excited. It's a good experience actually.
Yeah.
How about you, Doc? How is it going for you?
I'm planning on doing as many procedures as possible and presenting cases and what is it? Management. Yes, that's how I
just
go.
want to collect more patients.
King Doc, what about managing?
I'll try. I'll see how the day goes.
Yes.
I'll see how the day goes because as it stands now, things are very rough.
Rough? What?
Yeah.
Okay, just because
so
we're asked about the compartments of the hand.
First day, imagine.
Anatomy of the hand. Ish. About I just know that there's 5 fingers. This is me. So I just finished a class. I had an online class and I'm now going back to the emergency unit to do more emergency stuff. I love the emergency unit. Maybe I should just become an ER doctor, hey? Anyways. Yeah guys, I'm so tired. And to think this whole week I've been surviving on 4 hours of sleep. I feel like my body is gonna give up at some point and I might just pass out. But I got procedures to learn. And you know, my intern doctor was like, "You don't worry, you've got time." I was like, I don't want to hear that, because one day it's gonna be me and my patient and there won't be anybody else I can ask. So now is the time to learn and that's what I want to do. Ciao. All right guys, check you out on the flip side. And I'm doing last minute studying because we're having an IO patient and I'm doing anatomy of the abdomen real quick. Hi guys, it is 11:23 hours and this place is dead. It's so boring. There are no patients. Like, what's going on? I chose this unit because they have call on Friday, because Friday calls are the most interesting calls, you know. But I don't know what will be done, because I was really hoping that by now I would have learned how to suture or I don't know, do other things. But I'll let you know how it goes. Maybe we're gonna get more patients, but it's very unlikely. I don't understand. Where's everybody? It's payday, it's month end, and it's Friday. Where the RTAs? Where's the chaos? Where's the za? Anyways guys, I'm gonna go sort out my bed situation and maybe sleep, eh? I can sleep for a few hours and then I wake up like at 3 or something. Because one thing about me, I'm sleep deprived, child. I haven't slept in a since I started this unit. I haven't been sleeping. Just been reading, which is good because sure, like every time a doctor sees me, they're like, "What year are you in?" I'm like 7th year. They're like, "Okay, 7th year." And they just start pummeling me with questions and it's like, it's my first week of 7th year, okay? My first week. I haven't even had my first class yet. We haven't even been taught anything. So there's no difference between 6th year Sharon. But anyways guys, I'll see you I'll talk to you on the flip side. I try to wink. Good morning, guys. It's currently 4 a.m. and we just woke up. We finally found a place to sleep, and now we're going back into a meal. I hope there's patience. I really hope there's patience. I'm so tired, you guys. Like, so tired. Yeah. There are literally no patients. Not even one patient. So now I'm just waiting for the handover and I go home. So we went to ICU for the first time. Being in 7th year is weird because like the doctors actually like pay attention to you, and that's strange for me because when you're in 5th year nobody pays attention to you. You literally are so invisible. You could die and no one would notice. Like literally nobody would notice. But in 7th year, we're now rotating with the doctors in ICU. It's so serious. Like you get a lot of respect, but it's also a lot of responsibility. There's a lot to learn. There's so much I don't know. I keep getting asked questions and I'm just like, okay guys, this is where I'm ending the vlog. I am tired and exhausted. I feel like I'm going to be suffering for my sins for a very long time. So yeah. Okay. Check you out on the flip side. Hi guys, this is editing Sharon here. I know I look terrible. Please. I don't wanna hear it, okay? I don't. Anyways, everything I said in that video came true. I am sick as a dog. I am so sick. I crashed hard. I went too fast, too fast. I don't know, like I was just doing too much. I was literally sleeping for 4 hours, if that. There were times when I literally wouldn't even sleep. Like, what? And I was not eating. Like, I love the hospital so much. When I'm in the hospital, it's like I don't even feel like eating or anything. I don't know. It's a crazy thing to describe, but yep. And to top it all off, when I'm in the hospital, I'm moving up and down and I'm not eating and I'm not sleeping, and I'm just studying all the time. So after a week of this routine, I crashed. I'm sick as heck. I think it's because obviously being in the hospital all day, I probably caught some type of infection, whatever. But I think it was just exacerbated by my lack of health. Like I was not healthy, obviously. I think towards the end of the video, I was just like feeling tired, and then it all just culminated. Like I felt so bad. My symptoms: fever. I feel like I'm about to develop a cough, headache, and body pains. So first I was like, do I have COVID? And I'm like, well, maybe, but it's only this bad because of my terrible health. So I've given myself a study ban. Yes, that's true. I am banned from studying today, and I am instead gonna stuff my face and try to enjoy things I used to enjoy before. Alright, bye guys.